During a physical assessment, you will use all your senses and a systematic approach to collect information about your patient's health. During this video, we will learn how to assess blood pressure. Before starting your assessment, assemble the necessary equipment. The sphygmomanometer is a device used to measure blood pressure and consists of an inflatable cuff, a pressure manometer gauge, and a bulb with a valve. You will also need a stethoscope. Blood pressure measurements help evaluate cardiac output, fluid and circulatory status, and arterial resistance. It is necessary to maintain proper circulation and perfusion of the vital organs. Blood pressure is the dynamic pressure of circulating blood against the walls of the arteries. Blood pressure contains two separate components: systolic pressure and diastolic pressure. Systolic pressure is an increased pressure sent along the arterial walls with each contraction of the ventricles, and the pulse wave that it produces. This pressure is known as systole. Diastolic pressure is the residual pressure that remains in the arteries during the relaxing phase of the heart cycle when the left ventricle is at rest. This is known as diastole. Before taking your patient's blood pressure, inspect the patient's arm. Avoid taking blood pressure on an arm if the patient has an intravenous site, a central line catheter, fistula, or a port, has a mastectomy on that side, or has an injury to the arm. A blood pressure cuff contains the following: an outer cuff designed to be fastened snugly around the entire arm, a wide inflatable bladder sewn into a portion of the cuff, a ball pump with a one-way valve that allows air to enter, and a turn valve that can be closed or, when open, will allow air to be released at a controlled speed from the cuff. A pressure gauge calibrated in millimeters of mercury, which indicates the pressure that exists in the cuff that is being applied against the underlying artery. Auscultation of the blood pressure utilizes listening and is the most common means of measuring a patient's blood pressure. A blood pressure cuff is applied to the patient's arm, allowing for compression of the brachial artery when inflated. This compression creates turbulence and arterial vibrations that make sounds that can be heard using a stethoscope. These sounds are known as carrot cough sounds. As the one-way valve is opened carefully and the cuff is released, blood flow returns to the artery, and carrot cough sounds can be heard, denoting the systolic pressure. When the sounds stop, it indicates the diastolic pressure reading. Place patient's exposed arm extended with hand up, utilizing proper size cuff across the upper arm with the lower edge approximately 2 inches above the antecubital space, or the crease at the inside of the patient's elbow. Make sure the center of the inflatable bladder, which is usually marked by an arrow on the cuff, is placed over the brachial artery. To find the brachial artery, hold the patient's arm. Place your fingers on the brachial artery, apply some pressure, and you should be able to feel the pulse. Place the center of the inflatable bladder over the brachial artery. Wrap the end so that the cuff surrounds the upper arm snugly but not tightly. Once the cuff has been properly secured around the upper arm, the arm should be held about the same level as the heart. Utilizing your non-dominant hand, palpate the brachial artery in the interior aspect of the elbow. Place the stethoscope over the artery and hold it firmly with the fingers of your non-dominant hand. Hold the rubber ball pump in the palm of your other hand and the valve between the thumb and your first finger. Close the valve tightly and pump the ball pump until you no longer hear pulse sounds. Continue pumping to increase the cuff's pressure by an additional 30 millimeters of mercury. Slowly turn the valve, opening it until air is steadily escaping from the cuff and you see the needle of the gauge slowly drop. Watch the gauge and listen carefully. Note the patient's systolic pressure as the reading on the gauge at which taps or thumps of the pulse waves can first be heard clearly. The pressure will continue for a time, then suddenly disappear. Note the patient's diastolic pressure as the reading on the gauge at which the sound stopped. When the sounds are no longer heard, open the valve and release the remaining air quickly. Once you have finished measuring the blood pressure, document your finds and at the time at which the blood pressure was taken. If the patient's blood pressure is very low, you may continue to hear pulse sounds all the way down to 0. If this occurs, you should record the diastolic pressure as 0. Noisy environments and patient movement makes it difficult to accurately auscultate blood pressure. Taking a blood pressure by palpation does not depend on your ability to hear sounds, but by feeling the radial pulse. Always attempt a blood pressure by auscultation first. To measure blood pressure by palpation, secure the appropriately sized cuff around the patient's upper arm in the manner previously described. With your non-dominant hand, palpate the patient's radial pulse on the same arm as the cuff without moving your fingertips once you have located it, until you have completed taking the blood pressure. While holding the ball pump in your other hand, close the valve and slowly inflate the cuff until the pulse disappears, and then continue to inflate another 30 millimeters of mercury. As the cuff inflates, you will no longer feel the pulse under your fingertips. Open the turn valve so that the air slowly escapes from the cuff, and carefully observe the gauge. When you can again feel the radial pulse under your fingertips, you should note the reading on the gauge as the patient's systolic blood pressure. You will not be able to determine the diastolic pressure with this method. Open the turn valve further and completely deflate the cuff. Document your findings, including the time, and note the pressure that was taken by palpation. On your patient care report, you can record the blood pressure as 120 over P and verbalize it as 120 palpated.